The other big, possibly the more important story of the year, depending on how you look at it, vaccinations. Khayelitsha and Mitchell's Plain in the Western Cape, some of the lowest numbers of registrations for COVID-19 vaccinations. This is due to what people call vaccine hesitancy. Our reporter, Athi Mtongana, joining us now. Athi, good afternoon to you. People are in that area. They're trying to encourage people to register and to get the shot.
A very good afternoon to you, Stephen. I think it's very important to note that communities like Khayelitsha, where we are, and Mitchell's Plain have been flagged by the Provincial Health Department as one of the few communities in the Western Cape that has a really low figure in as far as registration is concerned for those that are eligible for vaccination during this phase. You may know, of course, that people that are 50 years and older are now currently getting inoculated in and around the country, but Khayelitsha and Mitchell's Plain are really recording low numbers of people registering on the system to get vaccinated. There are various reasons behind this. We have, of course, spoken to various health experts who've been talking about vaccine hesitancy. There are various reasons that have been put forward, but they are really trying to ensure that they educate community members from these communities to ensure that they are aware of what it takes to get vaccinated and the process of getting vaccinated against COVID-19, because in the Western Cape currently we have over 2,100 people that are currently in hospital due to COVID-19, and we have 530 people who are fighting for their lives in ICU at various hospitals, both from the private sector and the public healthcare sector, and that is a worrying figure, Stephen, because not so long ago the Western Cape was recording about 400 of those people in ICU, and today that number has gone up to 530 people in ICU due to COVID-19. Now let me quickly talk to you then about the process that is taking place here, where the MEC for Health, French Mbombo, was actually due to be here this afternoon, but she actually cancelled, Stephen, due to the fact that there's ongoing taxi violence in and around some of the communities in Cape Town, including Khayelitsha. So elderly people walk right through that gate. They get registered by some of the workers who are stationed outside here before they proceed into this hall. Once they get into the hall, of course, they get assisted by the healthcare workers that are here. This is one of the vaccination sites that has been activated by the province since the beginning of May. And it's interesting that today they're opening up a vaccination site at the CTICC. It's a mass vaccination site, much bigger than this one. The process here has been quite smooth. We've been speaking to people who are 50 years and older about the process unfolding here in as far as vaccination is concerned. At the CTICC, they're looking at vaccinating 4,000 people per day. That's a much bigger number compared to the smaller vaccination sites that have been activated in the communities around Cape Town. I'm going to bring in then a lady from the Neighborhood Watch. She is actually here with some of the other members of the community waiting on the MEC to address them, but of course the MEC has since cancelled. Sissy, won't you first of all talk to us about perhaps why you think people who are 50 years and older, and even those who are 60 years and older, are not registering in Khayelitsha for vaccination? What do you think is behind that?
Ndizawuthetha isiXhosa, sisi. Into endiyicingayo into okokuba behind all of that question you asked me, into yokokuba abantu bathi bazawuvaksina njani behlele ebugqwayibeni, bazawuhlaba inaliti baphinde bahambe baye ezindlini ezigcwele ikaka endlini apho siziripota khona ii-drains konke ilindle kwalapha eholweni naleya ilindle silijongile kodwa kuyavaksinwa apha. Yinto ethetha into kokuthi asikhuselekanga nje tu. Naloo nto leyo bazawuvaksinwa aba bantu badala u-60 upwards no-50 upwards, bazawuphinda bayohlala ezindlini ezi zinekaka ezi zinaba babantu bangekavaksinwa bona. Ithini yonke le nto lena? Siyifuna ingcaciso yayo yonke le nto lena.
Thank you so much, Noluthando Siya, for your time. Well, a community member here who's also involved in the neighborhood watch, just to loosely translate what she just said, she says a part of the reason why there is vaccine hesitancy here in Khayelitsha is that people are living in a situation where there are blocked drains all over, saying that it poses a health hazard because a lot of people are just fed up with the lack of service delivery, and she's asking how would they then need to be vaccinated before making sure that the areas that they live in is actually conducive for people to live in as far as service delivery is concerned. So those are just some of the reasons that she's putting forward. She had hoped that she would raise these issues with the MEC, but unfortunately she has had to cancel due to the ongoing taxi violence here in Khayelitsha.
Athi and Mtongana, thank you very much indeed. Important process underway in Khayelitsha. Of course, around the country, we're seeing more and more people getting vaccinated for COVID-19 as well, and promises from the health department that that process is only going to speed up.